Well, hello, everyone. Thanks for joining in our webinar on testicular cancer and a presentation here this afternoon. My name is Dr. Jaspreet Singh. I'm a board-certified urologist practicing out of Newburgh with St. Luke's, Cornwall, Montefiore St. Luke's, Cornwall in Newburgh, New York. And so I wanted to take through the opportunity that we have over the next few minutes to talk about what testicular cancer is, how it presents, and some of the most common treatment options that are available to us. Testicular cancer is by far one of the most treatable cancers with a high cure rate, and it does affect our young men starting usually in the early teens all the way up to about the age 40. As with any cancer, what happens is there are abnormal cells that start developing and dividing and control, and the division and growth of the cells are uncontrolled. And that's seen throughout many different types of tumor. This is not unique to testicular cancer. What happens within the cells in the testicles is that they lose the ability to control the cell cycle and the reproductive cycle of these cells. And one of the reasons why it's highly treatable is that cancer within the testicle is a fast-growing, and most fast-growing tumors tend to be very sensitive to treatment options such as radiation and chemotherapy. That being said, even though it is common in men, it still is relatively rare. But in the age group of 18 to 40, it is the most common type of cancer a young man can experience. So with a lot of cancers that we deal with, not just as a urologist, but as medical doctors, we don't know what causes cancer, but there are certain risk factors that are associated with the development of testicular cancer. Primarily, the history of an undescended testicle, or what we call cryptorchidism, increases the risk of testicular cancer by at least 3 to 4 times of the person who does not have a history of cryptorchidism. Although testicular cancer can arise from both testicles, for whatever reason, it seems to be more common in the right testicle. We don't have a good reason for that, but just as as an epidemiology kind of knowledge thing, the right testicle, the masses in right testicle are more common than the left. As mentioned before, age definitely has something to do with it. It affects young men, so that typically we encourage men to screen or perform self-testicular examinations till about the age of 40. And we'll get to that in a couple of minutes on how important that is and how to do that. Family history is important. A prior family history of testicular cancer increases the risk in the offspring. And also there's potential soft risk factors such as chronic testicular infections or chronic immune diseases like HIV. When we talk about testicular cancer, they fall into 2 different broad categories, of most common being germ cell. And germ cells are the cells that are important in the reproductive tract. They help with sperm production and maturation of sperm. Second most common is non-germ cell, things like teratoma. And then secondary testicular cancer, which is awfully rare, is typically cancer that has spread from other parts of the body. Some of the common places where secondary cancer can spread from includes bladder cancer and prostate cancer. So when we look into germ cell testicular cancer, there are, again, 2 broad categories, seminoma and non-seminoma. And seminomas tend to be the more common of those 2 subgroups. In fact, just to over 50% of all germ cell tumors are classified as seminomas. And even though all these cancers are arising from the testicle, the particular place that this seminoma arises from is within the cells that help produce the sperm. And so this is an animation just to better understand the normal anatomy of the testicle. The testicle itself has these coiled tubes called seminiferous tubules. These are very important in the production of sperm. The epididymis is the organ that lays on top of the testicle, which is separate from the testicle, is where sperm mature. They end up getting their tails. And so when people feel lumps and bumps in the testicle, one of the first places we try to distinguish is where the mass is arising from, whether it's the testicle or the epididymis. And so when we take a closer look at a microscopic level, what we see here is sperm production here. These are the germ cells that are providing the area for these sperm cells to mature. And so what happens here with tumor production is that these cells are reproducing at a much higher rate than normal germ cells. And so the testicular masses or lumps occur when you have a confluence of these cells that turn up reproducing, and lo and behold, after a few months to weeks, a few weeks to months, one can start developing a mass on the testicle. All right, so when we look at non-germ cell tumors, there are two main types. They fall into what we call Leydig cell or Sertoli cell. And these type of cells are the ones that help, one, produce testosterone in men. Those are the Leydig cells. And the second one is Sertoli cells, which help provide the nutrients and provide an environment for maturation of these sperm cells. So these are what we call supportive cells of the within the testicle, and non-germ cell tumors can arise from these areas. Again, less than 10% of testicular cancer fall into this category. As mentioned, when cancers don't arise in the germ cells or the supportive cells of the testicle, they may arise from other parts of the body. Common places where other cancers can spread to the testicle include the prostate, lung, kidney, the GI tract. That includes colon cancer, and also melanomas, also known as skin cancers, can spread into the testicle. How do we know where these, what type of tumors these are, or where the origin of these tumors are? Involve either biopsying the testicle or actually removing them so that our pathologist can look under the microscope to better categorize where these tumors are from. Let's talk briefly about signs and symptoms of testicular cancer. Now, one of the blessings of testicular cancer is that it presents with a lump or a mass within the testicle. Oftentimes, these are painless. So that's why it's so important to self-exam and for young men to get to know what their testicles feel like. Most of the time, testicular cancer arises like a nodule. I tell my patients it's almost like a lump or a knuckle, rather. So that lump feels like a knuckle or a hard firmness. Patients can experience a feeling of heaviness in the scrotum, and that can be from the enlargement of the mass that's involving the testicle. And what we don't want to hear, which can result in men who ignore these lumps, where the cancer can start growing and spreading throughout the body, one can start developing abdominal pain, loss of weight, and just generalized fatigue or weakness because the body is working in overtime and trying to recognize and fight off the cancer. And so remember, the take-home message is that these masses can be painless. Sometimes we discover them incidentally when a patient may experience a trauma or perhaps playing basketball and has somebody that bumps into the scrotum and then brings attention to that area, and they may find that there's a lump. But the routine physical exam, even at home once a month, is very important. What do we do in the office? Well, of course, seeing a doctor, a good history, and a physical examination. Some of the things that can mimic a testicular tumor includes an infection of the testicle. So getting a good history, making sure that there aren't any other associated symptoms such as a problem with urination, burning with urination, or perhaps exposure to a sexually transmitted infection. Part of the visit includes an examination where your doctor may feel the testicles, comparing the normal versus the one that feels suspicious for an abnormality. And ultimately, perhaps ordering further testing. And one of the easiest ways to pick up testicular cancer or an abnormality in the testicle is the use of an ultrasound, which is easily done in a non-invasive way to assess the testicle, done in the office or even at an outpatient radiology center. Again, monthly testicular exams are so important, and I have a slide on that, and I'll review that in how to perform that at home. So this is an image of what an ultrasound may look like. A lot of what looks like a fuzzy channel that's not getting the reception on the antenna. And what we're looking at here is the outline of a testicle. You can see that outline over here. Normal testicle under the ultrasound looks like that fuzzy channel, which is a mixture of the black, white, and gray pattern. What we see here, right in the center of the testicle, is a darker area, and you can see this irregular, what we classify as a irregular mass. And so this is a ultrasound that is highly suspicious of a nodule that has a high likelihood of being malignant or cancerous. So where we would start first with the physical exam may lead to an ultrasound. If a nodule is noted in an ultrasound, there may be other blood tests that we order. These blood tests are tumor markers that help us evaluate what the mass may be. Again, as you remember, I reviewed the different types of germ cell tumors that fall into the category of a seminoma or non-seminoma. And these blood tests help differentiate those two. Ultimately, obviously, we would need to remove the testicle to get the pathology of this tumor, but these tumor markers help give us a head start and also are very important for as far as surveillance, so that even when the testicle is removed, we may find that the tumor markers may be still persistently elevated, indicating that the cancer is somewhere else in the body. Or obviously what we are striving for is an undetectable level, reassuring us that the cancer has been removed and the cancer is in remission. If the testicle comes back as being cancerous, there are other tests that we do to help evaluate to make sure things aren't spread. That includes a CAT scan or a PET scan. All right, so this is one of the things we all learned as urology residents, and we continue to practice as urologists, that any patient with a solid testicular mass should be considered malignant until proven otherwise. And that is the kind of dictum that we all follow. Any solid component of a testicle warrants an exploration, whether biopsying the tumor, or biopsying the mass to confirm it's a tumor, or removing the testicle. Now, fortunately, most men were provided 2 testicles. That removing a testicle in the operating room does not affect necessarily a man's ability to have children or affect their testosterone levels or their sexual function. How do we initially manage? As I mentioned, the first line of treatment is an orchiectomy, or removing the whole testicle. The blood supply to the testicle comes from within the abdomen. When we are a fetus in development, the testicles actually arise inside the abdomen and they migrate into the scrotum. So they carry with them blood vessels and a lymphatic supply that arises in the abdomen, so that testicular cancers, when they spread, follow that blood supply. And it's very common if a testicular cancer is going to spread, will spread into the abdomen and will present with enlargement of the lymph nodes. And so those are the things we're looking for on the CAT scan. If a CAT scan indicates that there's lymph nodes that are abnormal, or even if a CAT scan is negative, depending on the type of cancer that we see after removing the testicle, may take us back to the operating room to prophylactically or therapeutically remove the lymph nodes and ensuring that the disease is removed in its entirety. So retroperitoneal lymph node dissection is a surgical intervention where we go into the operating room, removing as many lymph nodes as we can along the blood supply of the testicle into the abdomen. Certain cancers, such as seminoma, are very sensitive to radiation therapy, and radiation therapy to the abdomen allows treatment for cancer cells that may have migrated into the abdomen. Radiation therapy is well tolerated and very efficacious. Again, the reason why radiation therapy works is most of these cells that are the cancer cells in the testicle have a high turnover and they're constantly reproducing, and radiation therapy tends to affect those cancer cells sparing any effect on normal cells in the abdomen. There are also certain cancers, specifically, or I should say more commonly, non-seminomatous, that are sensitive to chemotherapy. Again, depending on the stage and type of cancer, chemotherapy may be a treatment option and typically reserved for cancers that have spread throughout the body. Just as a testament to how sensitive testicular cancer is to chemotherapy and radiation therapy, one of our, poster patients is Lance Armstrong, who is a world-renowned has won multiple Tour de France championships and bicycle tournaments. He was diagnosed with stage 4 testicular cancer, which means it had already spread throughout his body. He was fortunate enough that chemotherapy worked for him. And in general, for even the worst of testicular cancers, the success rate for both radiation and chemotherapy approached 90% 5 years after the diagnosis. All right, so again, the importance of testicular self-examination. Why? Because one obviously has to get a grip on their health. And this not only goes along learning about screening for testicular cancer, but general health and preventative care for the rest of the one's health. How do we do testicular self-exams? Well, testicular self-exams are best done in a warm shower, and the reason being that it allows the scrotum or the testicles to hang low, which makes it much easier to examine oneself. Most guys will say, "Doc, I have no idea what I'm feeling for," and so perhaps the first time learning how to do this with the doctor may not be a bad idea, but it's simply done by rolling the thumb and the pointer finger or the first finger over the testicle, and you want to basically roll over the testicle and feeling for any lumps or bumps. What you're feeling for, again, as I mentioned, may feel like a knuckle. And, if you start examining the testicles on a monthly basis, you can pick up any sort of growths or abnormalities that may be one of the first signs of underlying testicular cancer. And early, obviously, diagnosis is key because this, again, as I mentioned, is a very has a high success rate in treatment, and any sort of lump or nodule should immediately be seen by a physician in the office, which then can be further evaluated as mentioned before. So again, any men that are in their teenage years all the way up to the age of 40 should be doing this once a month. We tell our female patients breast exams are important. In the same way, it is imperative that young men start taking care of their own health, and very easy to do. So hopefully that allows everyone to get a better understanding on what testicular cancer is, how common it is, and what one can do to help prevent and pick up early nodules and abnormality. If there are any further questions, there are good resources online. And if not, one can seek out a consultation with me in the office and can easily reach me through setting up an appointment. I have a very easy number to remember. It's 1-833-Dr. Singh, 1-833-DRSINGH, and be more than happy to further discuss any sort of urologic issues one may have.